So doing the right thing when it is inconvenient, that is the summary of what we are going to be discussing this morning. If you look at the image on the left side, that's the easy way. Now you notice that the man someone has fallen down, right? You would think that is not easy, but that's what happens when you try to take the easy way out. Then there will be trips and falls. But you see on the other side, it looks difficult because they are cleaning up, but that happens to be the right way. Now, the way we are going to discuss this topic today is going to be a bit interesting in the sense that if you've got, of course, I know doctors, nurses, we've all had lectures on ethics at some point in time, and there's a way we discuss it. For example, in medical school, there's a way we are going to discuss this. But now we have a variety of hospital staff, and we want everybody to benefit maximally. All right. So how do we treat patients? We are going to be discussing that. How do we treat our colleagues? Are we permitted to just say anything to any colleague because the person is younger than you? Are you permitted to treat them anyhow? Are you expected to use the hospital resources anyhow because you have lots and lots of an item? Are you expected to just use it anyhow? And what do you do when nobody is watching? So when we put up the CCTV and the CMD is no longer looking at the CCTV, we used to be doing the right thing. Now, I'm going to start with a story. So when I was in training, I was working in the emergency department, and they brought in a young man, maybe in his 30s, who had peritonitis. So for those of us that know what peritonitis is, it means that a part of the intestine has perforated, in this case, and then it was a very big emergency. So he needed emergency surgery to save his life. So we counseled him, everything was ready. We said he needed urgent emergency surgery, but he refused. He said he was not going to have any surgery. We tried everything we could to convince him. He still insisted. His mother was actually there. We counseled the mom. The mom agreed and wanted him to have the surgery, but he refused. So what do you think we should have done? What do you say? We document it and then do what? He has refused, so we leave him to die, right? Okay, should Dama. Okay. All right. So what we did, we called in the legal department of the hospital. We called in the psychiatrist. He was evaluated. He was in his right frame of mind. Could understand everything that we were discussing with him, and he still insisted he was not going to have the surgery. So we did not operate on him, and he died, of course. So what we did, was it ethical? Was it ethical? Absolutely ethical, because we followed some basic principles of ethics. So we are going to be going through the principles of ethics, things that if you are in any situation, you should be able to apply those principles and it will guide you. Now, those principles of ethics are actually not set in stone. You have to be able to interpret them. So it's not just that once you see something, Dr. A is going to do this and Dr. B is going to do exactly the same thing. They don't have to do exactly the same thing, but the principle guiding them will be the same. So I'm going to start with beneficence. So benefits, we all know what benefit is. That's something that is of advantage to you. So as medical professionals, beneficence means that whatever we are doing for the patient must do them good. So how do we practice this? We must be able to explain clearly to patients. Many times we overlook the importance of explanations to patients and we just feel, okay, madam, your baby is big and you need cesarean section. and you expect that that's enough. No, that's not enough. This explanation is not only the work of the doctor saying the patient. There are many other people that work with the doctor. The nurses work with the doctor. Even the cleaners can explain things to patients. When you see a patient doing something wrong, you should be able to explain, even as the cleaner, that this is what they are supposed to do. You must ensure understanding before discharge. So you don't just explain and go away. You must be able to confirm that the patient understands what you say. You must go the extra mile during handing over. Nurses and doctors, do we just say, well, time has gone, please let me just hand over and go? Do you ensure that you take note of every little thing regarding the patient, and then you care beyond the disease? All these are doing the patient good. Alright. Now, the next one is non-maleficence, meaning that you do not want to do harm. You know, the first one we talked about was do good. Now, this is do no harm. In Yoruba parlance, they will say that, I won't say it in Yoruba, but they will say that if you cannot help me, leave me the way I am. Right? So, as medical professionals, we must try not to do harm. We must, however, be aware that by virtue of what we do, in quotes, it may look like you are doing the patient harm. If you want to do a vein puncture, you want to set a line, or you want to take a sample, you are trying to do the patient good, right? But while inserting the needle may go through the vein, and then there's a lot of swelling. Have you done the patient harm? You have done some harm now, yes. Because the patient can come back and say, before I came here, my hands were like this. Now see how big they are. So it is acceptable. There's that principle of double effect, where a little bit of harm, in quotes, is acceptable because you are trying to do good. You must be accurate with medication. So if you are supposed to give medications, you must calculate the dose and make sure that you are giving the right dose. You can't just say, well, it was a mistake. No, calculate the right dose. You do not verbally humiliate patients or colleagues because they don't know something. Of course, the patients are here because they don't have the knowledge that we have. So we can't just talk down on them like they are nobodies, right? No careless shortcuts. There are some things that, let's say for adventure, you have many cases to do, and you have a set of equipment that you've used for one patient, and you feel like, wow, I can't really run to the CSSD to get a new set of equipment. I just say, well, let's just use it for the next patient. Those are careless shortcuts. And then we have to protect confidentiality. So confidentiality itself is one of the principles of ethics, but we have just inserted it here. You don't see a patient on the ward and it's someone you know, and the next thing we are hearing the story in penal land markets. You learn to protect confidentiality of the patient, except in certain circumstances when you are permitted to breach that confidentiality. Now, autonomy, usually when we start talking about hospital ethics, this is actually one of the first things we talked about, and that's why I gave you that example. Autonomy means that the patient has a right to decide whatever they want. The patient has a right to decide whatever they want, and that's based on the assumption that that patient is old enough, according to the laws of the land, to make that decision. So a 5-year-old cannot say he understands everything and can make his decisions. No. It's also based on the assumption that that person is not incapacitated. So if you can prove that that person doesn't have dementia, or the person is not unconscious, is fully unconscious and is in his right frame of mind, then autonomy is so important. It means our duty is to inform clearly, document properly, and avoid legal battles. So if you worked with somebody who takes note of this, you find out that when you discuss with patients, You are giving them all the information, and then you say, what would you like to do? The patient can say, well, no, I don't want that. Or they can say, no, doctor, give me other alternatives. And then you either tell the patient that, yes, I agree with you, there are other alternatives you can take, or you say, well, there's no other alternative. So it's either we do this or we watch, and I do that a lot. And the patient is going to ask me, doctor, I don't want that, so what else can we do? I say, well, if you don't want that, there's no problem, we can just watch you. They'll be like, watch me? That's exactly what we are going to do. You know, so don't start fighting the patient, or these ego battles, trying to be paternalistic. Because the way I will tell my son, leave that place, is not the same way I will tell the patient, no, just leave that place. No. So they must always be given that right to accept or refuse treatment. Now, justice. How many of us have been treated unfairly before? Nobody. Alright, so what happens when you have a VIP that comes into the hospital? Do you say, well, this one is a son of nobody, leave him alone, let's take your VIP? And you channel all your resources to the VIP and ignore every other person? That is not ethical. Right? Do staff relatives jump queues? So if you are a staff or you have relations, you say, no, I work in this health center, so I don't think I should stay on the queue, or I don't even think I should pay. I mean, this is our hospital. But you see, justice demands fairness, regardless of status, tribe, religion, or wealth. So you don't bring somebody and just trample on every other person because you think that they are nobodies. That is the principle of justice and fairness, and we must always apply this. So can we remind you of the 4 things we've talked about right now? Beneficence, non-maleficence, autonomy. Exactly. So as we go about our activities in the hospital, we must always think about these 4 things. And if you want to do anything for any patient, remember those things and apply them. They will do us a lot of good. So I'll just talk about a few of, I say this for everybody, so I would pick on a few points. Now for doctors, honest documentation. You do not write what has not happened. So let's take, for example, you counsel a patient for something, and the patient says, please doctor, can you give me a minute, let me discuss with my husband outside. And then you document, the patient counseled extensively and she says she's not interested. That's not honest documentation. Or you see a patient and you've not discussed with the consultant, and you write consultant informed. It says this. That is not honest documentation, and that is not ethical. Timely referrals. So at the point when you decide to refer a patient, or that you think there's nothing more you can do for a patient, you should refer immediately and on time. We shouldn't delay patients unnecessarily. That is part of ethics for doctors. We must be able to admit errors. This is one of the difficult ones. Very difficult, especially in our setting. How do you admit that I caught this thing when I was not supposed to caught it? But there are ways of doing it, and there are ways of explaining this to the patients, and then they will understand. Avoid conflicts of interest. So let's imagine now that I have a hospital, and then as the patient is coming into this other hospital where I work, I would try and make sure that I make everything difficult for them. Then you will now say, doctor, please help me. I say, well, if you want me to help you, then come to my private hospital. So this kind of thing happens a lot in government hospitals. That's why you see patients will go there, and then they will say, when can you have your surgery? They will say 2030. They say, but if you want to have it faster, well, you can come to my private hospital. Yeah, so we must Even though we are not saying that people cannot have the hospital, but we avoid those conflicts of interest. Very important. For nurses, medication double checking. Very, very important. You don't say that that's what the doctor wrote. Yeah, so I just gave it because that was not. As a nurse, you also have some requisite knowledge, and you should be able to say, no, I know this is not what is usually given. So if I say, if a doctor writes for a neonate, paracetamol, 1 gram 8 hours, and you say, well, but that was what the doctor wrote, you are going to be liable. So you must speak up respectfully. So if you notice anything wrong as a nurse, you must be able to speak up and say, I don't think I agree with this. It's not about shouting, but it's about speaking up respectfully. Compassionate communication. You notice that there have been a lot of stories in the news in Nigeria of recent. There was a story of someone recently who delivered triplets, and those triplets were preterm, okay, or premature. I think they were premature, and all the triplets died. Now, but that's not the problem. That's not where I have a problem with. The problem is because they knew that they could not do anything for the units in quotes because they were too small. They just left them. When you have a patient in labor and it is the relation that has to be coming to call you that nurse, there's this thing that is happening, then you go, and then they have to come and call you again, there's a problem. So there must be compassion. Even when the patient has done the wrong thing, there must still be compassion. In fact, that is when you should be the most compassionate. So if you see a patient who has disobeyed medical advice and something bad has happened to them, that is the time to be more compassionate. Right. So we talked about maintaining confidentiality. We are exposed to the secrets of patients during our interactions with them, and we shouldn't use that as an excuse and say, maybe you are the pastor, and then on Sunday, you will now start using the patient as examples of how people should not behave. Right? So you are not maintaining confidentiality anymore. So pharmacists and lab scientists, very important. Ethics also affects you. You must verify prescriptions and doses. Just the way I said for the nurses. The pharmacist should not say a prescription and say, well, that's what's my business with the prescription. No, you must always verify. In the lab, our results must be accurate. If you see a potassium of 15, you don't just release the result and say, well, that's what it must be. So we must find out, why is this result abnormal? The results should not be altered. So you don't see a friend coming to say, well, HIV positive, but please help me to just change it. It's done in some places. Yes. So those are not ethical, because you'll be trying to help the person to get married. No diversion of drugs. So you don't say, well, I'm broke. They should understand that I'm broke. So let me just pick these few drugs and collect the money behind, and then professional integrity, even when under pressure. Okay. Can see it affects everybody. Admin staff, cleaner, security. We must all protect patients' information. So you don't say that because they brought a medical report to you to write for a patient as the admin staff, then you already know everything about that patient, and then you just meet on the way, and maybe you get into an argument, and the next thing is it not you that came here that had the abortion the other day? That's not ethical. No extortion or favoritism. Very, very important. Infection control, you see, we talked about it this morning. Infection control compliance. So if you don't comply with all those things that were mentioned, then they are not being ethical. Respect for patient's dignity. So you don't see a patient and you just expose them Just say, well, you are a patient, just expose. You know, that is not respecting patient dignity. Yes, so we're going to talk about something. We are going to get practical in a minute. Covering up errors. These are dilemmas. You begin to ask yourself, well, if there was an error in treating this patient, do I have to tell the patient that there was an error? Because if I tell the patient, they will probably now blame me as the doctor, and then they will go on social media and say, but that may not be true. It all depends on the way you have been relating with the patient and carrying them along with their care. Social media misuse. So you are doing surgery and just do the video and just post it online. We must be able to use social media appropriately. Or you are taking care of a patient, or maybe you see something very strange. You see a baby with 2 heads, and the next thing you just put it on social media because you are trying to make people know that I've seen something strange. Is that correct? Yeah, we must always think about it. We must always think about whether that's whatever we're doing is to the benefit of the patient. We talked about conflict of interest. Burnout, very, very important. So you have a doctor that's worked 48 hours and you ask him to continue working. Is that ethical? Right? So whatever we do, we must make sure it preserves dignity of the patient. So this is a 5-question ethical test. So you can put everything, every decision you want to make for a patient, whatever it is, put it to the test. Is it legal? Now, so there's a little bit of a difference between ethics, as we're discussing it, and the law. Yeah. There's a thin line. So, and the way you can look at it is, if you are in a football field, you have a referee, right? So there are things that are permitted within the football field. Let me give you an example, because I watch football. If somebody is trying to make, how many people watch football here? Yes, the ladies, some of the women watch football. So now somebody is trying to send in a cross, right? And then the defender is trying to head the ball out. Meanwhile, the striker of the other team pushes him so that he can head the ball. What do you think that defender should do? What? So, the defender can decide to be strong and say, no, even if you push me, I will just move a little. But when he moves a little, the striker is still going to score because he has pushed you. So, but the other option is that he can decide to exaggerate his fall. He will exaggerate and shout. And then the referee will quickly blow and say, oh, that's a foul. So is that ethical? Alright, so it can actually be, we can say it's ethical because that's still within the ambit of the football field. But there are some laws outside of the football field. Alright, so there are some things that you will say to a fellow footballer, and when they hear it outside, they say, no, according to the law, we don't permit racism, for example, in football. So the law is supposed to guide us from the outside, but the way we apply it to our practice is the ethics of it. Now, there are different laws in different countries. So the abortion law in Nigeria may be different from the abortion laws in the US, right? But the ethical practice is the same. So you can see that at some point there might be like a clash between the law and how you want to practice the ethics of your profession. So whatever you do must be legal, otherwise the police might come and arrest you. Is this policy compliance? Every hospital has their policies. So do you have a policy of do not resuscitate in critically ill patients or terminally ill patients? Do you have that policy in your hospital? If you have it, then you follow it. All right. Would I do this for my family? Very, very important. Would I be comfortable if everybody publicizes this? You know, there was I once gave an expired medication to a patient. I did not give it unknowingly, I gave it knowingly. And before I gave it, I explained to the patient. The patient was very ill and we didn't have access to that medication anywhere. So maybe the medication expired maybe maybe about 1 or 2 months before. There was no way we were going to get that medication. So I explained to the person, this is the medication, or is expired. Should we give it or not? Now, would I do this for my family? Absolutely. I would have given that medication if that person was my family member. Yes, I would have, which was the reason why I was offering it to that patient. Because it would be of benefit to that patient in this circumstance. So, we're talking here about risk and benefit. If I thought that the benefits of using that medication would outweigh the risk, then I would give it. But the patient has a right to say no. Okay. But would I be comfortable if it's publicized? So would I be happy if everybody says, oh, that doctor gave expired medication? I may not be. So, thinking about it again, maybe one would just say, well, maybe I shouldn't have given it. Does it preserve dignity? So, put it to all this, put your circumstances to any of these 5 questions, and then you'll be good to go. The hospital needs to build an ethical culture. Every organization, every hospital needs to build an ethical culture. And how do we do this? By encouraging reporting without fear. So if somebody comes to say, I made a mistake, they come out on their own. Do we victimize them and say, why would you make that mistake? So we are suspending you for the next 3 months. See, it's different from when you catch somebody doing something. No, this person has come forward and said, I made this mistake. How do we respond to them? Leadership by example, very important. Structured accountability. That means we must make accountability in a way that is very easy for us to fit into. And continuous ethical reflection, like the example I gave about this expired medication. Continuous ethical reflection. So you think about it again and say, well, was it a good idea? Maybe. Would I do it next time? Maybe not. What's the cost of unethical practice, litigation, and license loss? So when we don't do these things the way we are supposed to do them, then we end up doing lots and lots of cases in court. Have you not talked about it that many times if you see the traditional bone setters, they destroy lots of limbs, right? Do they go to court? They don't take them to court. So they must be doing something, even though what they are doing is unethical. By our own standards, maybe by their own standards, they are doing some ethical things. So patients don't take them to court. So it means that communication is so important. It leads to loss of public trust. That's what's happening in Nigeria now. Loss of public trust. Once they hear anything, everybody comes out and says, yes, that's how those hospitals behave. And that's because some hospitals may be doing the wrong thing. In all honesty, they may be doing the wrong thing. But most times because we are just not following the ethics of the profession. Institutional damage. That's a lot. And loss of personal integrity. Hospitals are sacred places, and patients must be able to trust us even in their vulnerable states. There must be excellence, and ethics must go along with it. And skill without integrity is a liability. Alright, so let's discuss. As a nurse, you administer a higher dose of a medication. So you have a prescription, a prescription, but mistakenly, you gave a higher dose of the medication and you put your hand on where I've given the wrong dose, but the patient shows no immediate reaction, what do you do? As the nurse, what do you do?
Someone mentioned in my unit, I'll personally report the next senior.
Alright, so she says she's going to report to a senior person. Do we all agree? Do we all agree? Okay. Alright, so she's putting another angle to it. But okay, let's finish with it. So we all agree that it should be reported. But before now, will most of us report it? Before now, would most of us report it? You are not likely to report it. You are not likely, because and this is practical. Let's look at it like this. Don't look at it. You are supposed to give 500 milligrams of processing, and you give 1 gram, and then you go back to check and say, it should have been 500 milligrams, and then look at the patient like, it's processing now. Really, there's nothing that will happen to the patient. That's what most of us would do. Is natural. But the essence of this discussion is for us to know that even when nothing happens to the patient, still report, I made a mistake. I gave 1 gram instead of 500. They now say, okay, that's. But because if we don't learn to be transparent, you can see transparency versus fear of blame. The day when it's going to be more important, you will still give it to yourself, and then the patient will die. Okay, so the institution must encourage reporting. And when it is reported to the senior person, the person should not say, you see, I'm always telling you, you are careless. You are careless. That's why you be killing patients everywhere. Right. The VIP patient, we talked about this. An influential community leader, maybe in camp, arrives. So staff are pressured to move them ahead of others. What happens to triage fairness? They throw triage away and say, no, triage, stay in one place. These are things that we cannot run away from. In fact, if the president of Nigeria enters this place now, maybe we'll just end this meeting. So there are some things we cannot run away. These are practical scenarios. But the essence of this discussion is for us to always remember that we must, even though you are giving that VIP treatment, you should not ignore every other person. You must not say, well, today, because there's this VIP, nothing concerns me with you, maybe I just take care of the VIP. No. So there must always be justice. Justice, very important, should be greater than social pressure. The exhausted doctor. At least I know that our doctors don't do this one again. A doctor on 36-hour call must review critical labs. Fatigue affects concentration. Should they continue? No. In the past, you do calls. There was a time during my residency training where there were 2 of us as registrars in the unit. There was no senior registrar. And it was in a very, very busy unit. So it was just 2 registrars, the consultants, and of course house officers. And as registrars, we were doing alternate day calls. Meaning that if I come to work by 8 o'clock today, if I'm on call, I'm going to work till tomorrow morning and then continue working from 8 o'clock tomorrow morning. Now, the following day, when I'm not on call, I may be going home somewhere around 9-10 o'clock because there's a lot of work to still do. So I go home at 10 p.m., come back by 8 a.m. the following morning, and then I'm on call that day. That's too much, right? And the way to think about it is, if a doctor is fatigued, I'm tired. His thought process is not the same. Somebody sent me the lab results sent me our own lab result, thyroid function test, yes, 2 days ago. It's a patient that I knew maybe like 6 years ago. So she had thyroidectomy and was on thyroxine. She did a thyroid function test that was almost essentially normal. There was just a little bit of, TSH was just a little bit elevated. So she showed it to a doctor. The doctor misinterpreted the results and said the dose of thyroxine she was using was too much. So he told her to reduce it. After a while, she went to repeat the test. By this time, the test was now completely abnormal, showing that the dose of thyroxine was too small. You know what the doctor told her? Is that she should stop the drug completely. So that's the kind of thing that can happen. This one did not happen when the person was burnt out. This one did not have any knowledge. But these are the things that can happen when we are burnt out. We just do not take the right decisions. So patient safety is more important here. We've talked about the social media temptation. So maybe you want to prove that you're a good doctor. You want to prove that you pray for your patients. So you now do a video where you are praying. But you've forgotten that you are praying, that patient's face and everything is showing. Right? So if we are going to post videos of people online, you must have their consent. They must agree that you are posting them. Alright? And this is why also in theaters and so on, we just don't allow people to come in and do videos, because you never can tell. Someone will just say, doctor, that was my video you are posting on YouTube. Did you let me know? No. Right, so is it harmless educational sharing? Confidentiality is so important. We've talked about this referring patients to private facilities. Investigations may not be strict. So is it ethical business or exploitation? These are the questions we need to ask ourselves. Significance of the gamma form. I usually say it. I think we signed the most gamma forms that I've ever seen in this world. Before I came to this place, I have never seen that number of gamma forms. Never. I'm telling you. And I think that on an average, maybe the number of gamma forms, maybe you sign as many as full block countries. This thing requires. If you go and check those gamma forms, you'll find out that what is written there makes no sense. That gamma form is really of no use. Ask yourself, if that patient signs the gamma form, walks out, and comes back, will you take care of them? Yes. So, but you think that signing the gamma form is maybe to make the patient afraid of going away. It's not supposed to be so. What is more important than the gamma form is patient communication, education, and documenting your explanations. So many of those gamma forms, you just write, I, blah, 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 decided to take my patient away despite the fact that I know the consequences. What are the consequences? Have you explained the consequences to the patient? Those are the things that, so if you don't, in fact, I don't think I've ever filled the gamma form before, ever. I'm not saying you must not fill gamma forms, but I'm saying the number of gamma forms you are filling are too many. Once you are filling those forms, you know you are doing something wrong. It's either the patient is already fit for discharge. For example, I may see a patient who has appendicitis and I want to do an appendectomy for the patient. But the patient says, no, I don't want an appendectomy. We start antibiotics, and by the following day I say that the patient is fine. I don't have to say, no, you must still do that appendectomy. I can allow the patient to go. So we don't have to say you must sign the gamma form if you are going, because you are thinking if I allow him to go and something happens, they will now say why they are allowed to go. That means you don't understand the practice of medicine yet. If the patient is going against your instruction, then you have a right to refer the patient. It's not for you to keep the patient there and say, well, if you want, in fact, sometimes they'll just say, madam, if you want to sign that man, please come. So it means you are, in fact, some people will even write it, encourage the patient to dama. I've seen it before. Encourage the patient to dama. So please let the dama rates drop. Let's communicate more with patients. Keeping patients who cannot pay hospital bills on admission. That's another one. Just like I said, ethics is very flexible. So it means that there might be situations where you keep patients. But when you know a patient cannot pay your bills, is it ethical to keep the patient on the hospital bed? Because somebody will say, well, if we allow everybody to come in and not pay and go, then the hospital will crumble. That is also true. However, you must be wise, because two wrongs will not make a right. So you can't say that because you cannot let everybody go free, so you will treat then go and park everybody on the street and leave them on the hospital bed because they cannot pay. Right? So we must always ask ourselves those questions. Allowing patients' relations into the operating theater. What do we think? Yeah, sometimes some hospitals have some policies guiding that. So if the hospital has a policy guiding it, we follow it. If not, we must be careful when we do it. There might be select circumstances where we can have actually done it before, we allow patients to go in. But the risk there is the theater is very unpredictable. So I've seen a situation where somebody is operating and so there's this hospital where they do a lot of obstetric cases, but something has happened before that the relations blame them for. So what they now do is, whenever they are operating, maybe there was a problem with exchange of babies or something. So when they are operating, they will now create a place where the relation will sit down and be looking at everything, so that you will not exchange their babies. So when you are doing the surgery, what can happen? Light goes off. Jane does not come on for 15 minutes. Everybody is shouting. What do you think is going to happen? Right. So that's where wisdom comes into it. Many patients think that once light goes off in theater, the patient is about to die, as far as they are concerned. Right? Managing bad cases. Must we manage every bad case? No. If, like the patient I told you refused surgery, that was a tertiary facility. So, I mean, everybody will understand that well, he has agreed. Like, but if it's to be in this center now, will you keep the patient and say, you refer the patient? Okay. Alright, there you go. Questions? It's the end, but not the end. Question.